Okay, so I'm going to give a demonstration of the head to toe assessment. So you'll come in with your test out sheet, and if you have a note card, we will have the supplies here for you, and you have 25 minutes to complete that. You can look at your note card once during the test out. So I'll give this to my instructor, and I apologize, I do not have a real person to do this on, but you will do the assessment on your lab partner in the lab. So for the demo, we're just going to go ahead and use the mannequin. So I'm going to come in and I'm going to introduce myself. My name is Nicole. I'm going to go ahead and be your nurse today. I'll be doing a head to toe on you. I'm going to go ahead and wash my hands. And could you please give me your name and date of birth?
Susie Q, 12/30/1980.
All right, that matches the ID band. And do you have any questions before we start the head to toe?
No.
Okay, so first we're going to just start off with a couple of questions. You've already told me your name. Could you tell me what the date is today?
2/26.
Okay, and what year?
2016.
All right, excellent. Can you tell me who the president is?
Barack Obama.
Okay, and can you tell me where we are today?
We're at Kirkwood Hospital.
Perfect. Okay, so next I'm just going to shine a light in your eye. All right, so I'm going to do direct, and then indirect, I'm looking at the other side, and I'm making sure that their pupils constrict. Then I come on this side, direct, indirect, and then finally, if you could follow the, with your eyes, follow the pen, and we're going to come in right to the nose, and you should see the pupils constrict and converge in, and that's our accommodation. So that's our perla. Then I'm going to inspect the face, and I'm looking for symmetry, and then could you please smile for me? And I'm making sure that the smile is equal and symmetric. Then I would inspect their gait. Obviously the mannequin can't walk, so when you're inspecting their gait, you're just wanting to make sure that their posture is erect, that they have a smooth and steady gait. Then you're going to do push-pulls on both uppers and lowers. So for this, remember, they're going to put their arms up, and you can push against me and then pull towards yourself. And then I'm going to go ahead and do grips. So again, just put the two fingers out and go ahead and squeeze. Very good. And you're making sure that muscle strength is equal and strong bilaterally, and same with the grips, that they have equal strong grips. Then we're going to move down to the feet. And again, we're going to do push-pull. So push down on my hands and then pull up towards your nose. Excellent. Then we're going to move on to thorax. So do you have any thorax or lung disease?
No.
Okay. And do you have a cough?
No.
All right. If they did say yes to a cough, I would want you to follow up and say, could you describe your cough to me? Is it productive, non-productive? Is it a dry cough? Do you feel short of breath?
No.
And are you a smoker?
Yes.
Okay. So if they say yes, you need to follow up with how many packs?
1.
And for how many years?
20.
Okay, so then I'd make note of that. Are you interested in quitting?
Not at this time.
Okay. So next I'm going to go ahead and do my inspection. So I'm looking at their respiratory rate, how they're breathing, and also kind of the shape of their chest. So do they have a barrel chest? And again, it'll be easier on a real person when you can kind of go around and look, but I don't see any barrel chest at this time. Then we're going to go ahead and listen to lung sounds, and for lung sounds we're going to listen on the skin and using the ladder method. So every time you hear or you feel my stethoscope on your skin, could you please take a breath? So deep breath. And remember, if it's a gentleman, you can go down a little bit further. Then we're going to move over to the back. And 1, 2, 3, 4, 5, 6, and then 1 on each side. All right. Then we're going to move on to cardiac. Do you have any cardiac disease, high blood pressure, high cholesterol, any troubles with your heart?
No.
Okay. How about any chest pain?
No.
How about shortness of breath with activity, like when you walk up a flight of stairs or you walk into your kitchen?
No.
And how many pillows do you sleep on at night?
Just 1.
Okay. Next, we're going to listen to heart sounds. And first, I want you to tell me where the valves are best heard. So give me the landmarks. So aortic is the second intercostal space right of the sternal border. The pulmonic is second intercostal space left of the sternal border. The tricuspid is fourth and fifth intercostal space left of the sternal border. And the mitral is fifth intercostal space left mid-clavicular. For this, you can go over their clothes. You don't have to be on their skin for heart sounds. So we're going to go ahead and listen. Okay. And again, I'm listening for S1, S2. Is it regular? Is it irregular? I'm going to be checking for leg edema. And I don't see any edema here. While I'm down here, I'm going to go ahead and check my pulses. So I'm going to check for the dorsalis pedis. And again, if you can't find it, you would say I would go get a Doppler. But for the test out, you don't have to run and get one. But if you can't find it, that's what you would say. And I'm going to come back up here, and you're going to check the pulses bilaterally. So then I'm going to check radial, and I'm checking that bilaterally. And then I'm going to go ahead and check cap refill. Okay, next I'm going to move on to the GI system. So do you have any GI or tummy troubles?
No.
Okay, do you have daily bowel movements, or how often are your bowel movements?
Once every other day.
Okay, and is that your normal patterns then?
Yes.
Okay, do you have any trouble voiding?
No.
Okay, and how about passing gas? Are you passing gas?
Yes.
Okay, excellent. So then we're going to go ahead and inspect. And so for this, you're going to have to pull up their shirt a little bit. And I'm looking at the overall contour. I'm looking at the color. I'm looking at symmetry and making sure it looks symmetrical and there's no hernias or bulges. I'm also checking the umbilicus to make sure that it's midline. Then we're going to go ahead and listen to bowel sounds, and we're going to start in the right lower quadrant. So we're going to start down here, listen, work our way up, and then move back down. So active bowel sounds. All right, and then finally, oh, I forgot to palpate. And we're going to go ahead and palpate. So light palpation. Are you having any pain? Nope. Okay. Then we're moving on to skin. And so for that, we're just looking at the overall, we're starting off with inspection. So for skin, we're looking at the overall color. We're looking to see if there's any sores. We're looking for any, we're looking to see that things are symmetrical, and that hair distribution, that's on the legs. So we're looking at the hair distribution on the legs. Then you can go ahead and palpate, and for that we would be checking temperature. Okay, we can see if the skin is dry or moist. We'll check skin turgor over the clavicle, and also looking and feeling for any edema and checking for any swelling, which I don't see. Again, we would repeat that up here with the arms, looking at temperature, if it's dry or moist, looking for edema, and then also checking skin turgor over the clavicle. Once we're done with our assessment, if you'd like to look at your note card, that would be a prime opportunity to look at your note card, see if you've missed anything. I don't think I missed anything, but I could have. Then we're going to go ahead and lower the bed, make the patient safe, tell them what the plan is. The physician's going to come see you in a few minutes, make sure they have their call light, and wash my hands.